Coming up next on WVOX, licensed insurance agent and Medicare specialist Mark Brownstein hosts his monthly educational segment, Medicare Mark on the Air. Tune in for guidance, special guest interviews, and valuable information on all things Medicare.
Hello, WVOX listeners. This is Mark Brownstein with Emerald Medicare here on the second Monday of every month. Happy to be here with a very special guest, Denise Kuhbier. And we are here talking today about the work that she does in many areas of healthcare and nursing. Again, Mark Brownstein, Emerald Medicare, all things Medicare. And we help so many people all year long. And so I want to just simply introduce Denise to our radio listeners. Good afternoon, Denise.
Good afternoon. It's a pleasure to be here.
It's nice to have you here. And I've known you through a few of my career changes, and it's nice to have you here today with me. I actually know one of your colleagues, Ron Gold, quite well, and it's nice to have you here in the station with me. And you are from the Westchester area. I do know. Yes?
That's true. I'm a Yonkers, born and raised in Yonkers.
And where are you now?
So I live in Mahopac right now. I've been there about 20 years, but I was raised in Yonkers. I have a big family. My maiden name is Verino, and there's a lot of us out there. Moved a little bit and then ended up raising my family in Mahopac, New York.
We were just talking earlier. You have 2 children in various colleges.
I do. I have a 21-year-old son, Austin, and he's in University of South Florida in Tampa. And my daughter, Selena, is in Westchester University in Pennsylvania.
Well, that's wonderful. It's always nice to get a feel for the family and the fact that you are a local product made good. So you went to Pace and Iona. You have a history in your education here locally as well.
Correct. I went to Saunders High School, then went to Pace University for my bachelor's degree in nursing. After that, a bunch of my friends and I went to Iona College, where I got my master's degree in health administration, and subsequently started my nursing career, or simultaneously had a nursing career. Started at at Our Lady of Mercy in the Bronx, moved around a little bit in med-surg, went to psych at Four Winds, and then to Westchester Medical Center in the acute psychiatric ward for many years. After that, I started a home care agency and then went to work for Priority Home Care. And then I would say my nursing career has a little bit of hospital, a lot of assisted living, and then home care, a home care component to it. So I have all the different areas of nursing that are important in terms of understanding how someone at home needs to be taken care of, and whether home is the right place or assisted living might be the right place for them.
So that kind of conversation with the patient, the client, or their family, what setting is correct for them, and how do you sort of go about that conversation with them to help them make that determination, and what are some of the key areas?
It's really a tough conversation. There's no doubt about it. Some people want to stay at their home and they do not want to go anywhere. They promised, their family members promised them that home would be the place that they would stay and they would never place them. Whereas other families want their loved ones in a place where they could have good cooked meals, have an opportunity to interact with other people, have activities. So you really, not one setting is right for anybody. You really have to determine what's important financially. Where should they be? And sometimes children want them to be close to them, and so that plays a big part on where they should be as well.
So over the last many years, you've been associated with Lean On We. You do a lot of work for seniors and their families. What is it that you see these days, maybe with COVID included, as to what seems to be on people's minds in terms of the care of their parents, their own individual care, that becomes sort of the most important areas that they want to focus in on.
Yeah, so you've had Ron Gold, who's the founder of Lean On We, on the show in the past, and I'm the vice president of care at Lean On We. I'm the nurse that really helps to decide if we could take care of somebody or actually place an aid in their house. We're not a home care agency. We're like a matchmaker. We help people find private duty aides to hire at home. So we do all the vetting and screening for the caregivers so families can hire them. And I would say we get a lot of calls over the past, since COVID began, looking for more live-in home care aides. The families don't want people coming and going. They don't want multiple caregivers in the home. They want less risk of introducing COVID or anything else to the family members. So they like somebody that would stay put for as many days as possible. So I would say that's one of the best things, and one of the things that Lean On We does in such a way that helps people save money, and it gives people an opportunity to choose who comes into their home, and and the skill set that's needed when they're choosing the caregiver.
So the hardest part is finding the right fit, right? I mean, people want that they want somebody they can talk to or have a companion. So how do you sort of find that right fit for the individuals? Again, I'm sure you get to know the family quite well.
Mm-hmm. It's a good question. So personally, I don't see people in person. All my communication with families is done over the phone. So families will call in and tell me, I need a male or a female aide. Here's where I live. I have a dog or a cat in the house. I need a driver. I need somebody who speaks a certain language. Maybe I need a certain type of cook, a special diet. They'll tell me everything that they're looking for. And Lean On We has any given time caregivers that we've already vetted that could meet their criteria. We have a system where we could put all that stuff in the computer. I want a driver. I want somebody who speaks Russian. I want somebody who will work in a house with two people, someone who will work in a house with a dog or cat. And we've already asked those questions to all the caregivers we have on our network. So it's an easy way for us to source whether we can find a caregiver for that client.
So with all that important work, what are the things on your day-to-day basis that gives you the most joy in working with family?
So that's as a nurse, I think that educating people is a priority for me. I find that people call in and they think they know what they're looking for, but I'm actually able to help them find a caregiver at the most cost-effective way and just educate them. And I'll give you, for instance.
Please.
So a lot of times people are being discharged from short-term rehab or a hospital, and the social worker or the discharge planner will say, you need 24-hour care. And people automatically think 24-hour care is, I need 24-hour aid services in the house. And that's not exactly true. So I like to educate people on this particular topic that they should ask some more questions. They should dive down and ask questions. What does 24-hour care mean? Do you really mean 24-hour care, or do you mean 24-hour supervision? Because 24-hour supervision can actually be a family member, right? So if you hire an aide for a certain amount of hours a day, the rest of the day could be the supervision of the family if they want that responsibility. So it's a more cost-effective way. 24-hour care can also mean I need 24-hour I need a 24-hour person in the home. It doesn't necessarily mean that they need to be awake at all times. So there's something called a live-in. You could have someone that lives with your family member, and when they go to sleep, the caregiver goes to sleep. Caregiver is supposed to have 8 hours off, and 5 of those 8 hours should be continuous sleep. So that is a real way of saving money as well. The last one, which is the most expensive when you talk about 24-hour care, is having somebody alert and awake at all times. but people don't know that there's all these different types of 24-hour care. So for me, it's important that when they call in, they tell me what they need. I'm educating them and asking them questions that will help them to dive down on what they really need and understand.
That sounds incredibly important and a big cost saver.
Absolutely.
So when someone looks at 24-hour care or 2 12-hour shifts, and they deal with potentially private pay because many people don't have long-term care insurance, then you are helping them save money and get the right kind of services they need based on their needs and their budget.
Absolutely. And even with long-term care insurance, some people have a set daily amount, and that you want to maximize the amount of coverage you're going to get for that daily amount. And so therefore you want to find the best opportunity out there to hire a caregiver, a qualified caregiver at a price that you could afford, that your long-term care policy will cover the entire thing.
So what percentage of people that you work with actually have long-term care insurance, and how many people maybe look towards Medicaid as a potential solution?
That's a good question. So we do get calls for long-term care insurance, and we don't accept any type of insurance at Lean On We. That's not our model. So everybody who calls is either private pay or long-term care insurance, or they have Medicaid and they're looking for what's called a consumer-directed personal assistant aid. So it's called the CDPAP program, where you can hire your own caregiver. They just have to register with Medicaid. So we don't do that much of that. I would say maybe 5% is through Medicaid, maybe 20% is long-term care, and the rest is really private pay.
So you spoke of Medicaid, and we were talking earlier, and there's a population of people that find themselves with the need or desire to go onto Medicaid. So what does Medicaid give them additionally that may be advantageous for them to sort of find a way to protect their assets and move into a Medicaid model?
Yeah, so Medicaid in New York State is different than any other states. There's just no way of explaining it. The look-back period currently for community Medicaid, there is no look-back period. So people usually call and they say something like, okay, my 5 years is up, the look-back period. And I say, well, ma'am or sir, there is no look-back period for community Medicaid. But there is a look-back period for institutional Medicaid, which is the Medicaid in an institution, i.e. a nursing home. So if you sought out the assistance of a professional, an elder care attorney, to do your long-term care planning and applied for Medicaid and you were eligible, and if there's a whole thing about, putting your assets in a pooled trust and things like that, that's not my wheelhouse. But if you got accepted to Medicaid, you'd be eligible to have a certain amount of your aid services paid for. You could have your transportation, your incontinence supplies paid for. So those are some of the things. Maybe even your transportation to and from your doctor's office would be paid for.
Maybe a hearing aid.
Maybe hearing aids, too. Hearing aids will be covered as well. Yep. So there's different things that Medicaid would pay for if you're eligible and you meet the criteria.
Great. So Mark Brownstein here with Emerald Medicare, here with Denise Kuhbier. Happy to have you here today. And I know as another part of the busy world that you have every day is you volunteer. You're very active in some important areas. And so maybe talk a little bit about the volunteer work and the pride that you have in the work that you do.
Yeah, so besides working for Lean On We full-time, I'm a volunteer for the Alzheimer's Association. I've been on the Hudson Valley chapter of the Alzheimer's Association as a board member since 2017. And I also run the Putnam Alzheimer's Walk. And Lean On We has been for several years now the leading fundraising team. And I am proud to be the highest fundraiser for the Putnam Walk. And being a nurse for 35 years, I see the devastation that the disease has done to people and families. And I just want to help to find a cure and do as much as possible to help eradicate this illness. I really don't want it to be around for when my kids get older and anybody else.
Right. It's a great organization. I've had folks from the Alzheimer's Association on both of my radio shows, both here in Rockland and Westchester. And they're a great group nationally and worldwide. There's a tremendous amount of research being done, and all of those fundraisers, all of those walks. It's about the money, but it's also about the awareness.
Correct.
And so awareness, it could be said that it's, one of the most important and one of the diseases that is the least known, right? How it occurs in our bodies and our minds, and how families deal with it. Alzheimer's isn't talked about often amongst family members, right? When it used to be that something like cancer wasn't talked about, and now it's a much more common conversation. There's so many organizations that speak of cancer awareness. And so Alzheimer's awareness, from your perspective, is growing, and the education is there?
Yeah, absolutely. If you go to ALS.org, you could see the programs and services that the Alzheimer's Association offers. It's not, the raising money is to go to research, but it's also going to programs and services. Right. So if you are unaware of the next step or what to do, you're welcome to call the 800 number, and people will direct you to services that are available, programs, research, literature, all kinds of things. So it's a fantastic organization. And like I said, I volunteer my time quite often to help run the walk and to really work for the Hudson Valley chapter.
So we've been a sponsor for a number of years at Emerald Medicare as well. One of the things that I wanted to also talk about a little bit, and as you know, the world I live in is Medicare. And people, I think, assume to a large degree that Medicare will pay for everything, but it doesn't. And so you have a different perspective. We talked a little bit before the radio show about, Medicare and what people's expectations or needs are. So what do you try to explain to people about what Medicare covers and doesn't cover, and what is their reaction to that?
Yeah, so it's a hard reality check for people that have been paying into the system and believe that if something happens, they're eligible to get their companion-like services paid for or their aid services paid for. And it's sad, right? It's a sad time when I have to explain to them, no, your Medicare benefit is not paying for your companion. So Medicare does pay for what's called short-term and intermittent care, post a hospitalization or rehab, but that's it. They do not pay for long-term care. They do not pay for an aid next to your family member in case you need something. It's really, you need a skilled service that goes along with the physical therapist or occupational speech therapist or nurse that's in the home. Yes, you can have an aid a few hours a day, a few days a week for a short term, and then it goes away. And so it's, people are frustrated with that. They don't understand what they're paying for. But at the end of the day, Medicare does not pay for long-term aid services in the home.
So, as I often communicate on that same topic to people, there are the Advantage plans, and then there are supplemental plans. On the Advantage plans, you've got 20 days
Correct.
Of rehab. And on the supplemental plans, it's 100. And so there's a lot of conversation that goes on with people understanding their plans at that critical juncture, when for the first time in someone's Medicare life, they're all of a sudden in a hospitalization rehab scenario looking for skilled nursing, then trying to go home or being told that their coverage is ending.
Right, and that's why there's specialists like you out there, because people don't understand that they have to really pick the right plan for them for what they want ahead of time, right? You can't be in the hospital saying, I want to go to that rehab and I want to stay there for a certain period of time if your plan is not covering that.
In network.
Yep.
Right.
Yep.
So yes, I mean, New York, similar to the Medicaid piece, New York is one of only 4 states in the country where you can change from a Advantage plan to a Medigap Med Supplement plan without any health questions asked. And that is incredibly beneficial when people are in a situation where if they're in other states, they would have to go through underwriting. and they wouldn't be passing underwriting. So New York is a tremendous state, as in Connecticut. And so those rehab days, 20 days seems short. 100 days feels a lot better, doesn't it?
It really does. So I didn't know that. So thank you for sharing that information. I did not know that about New York and Connecticut. But that's why it's so important not to necessarily listen to your friend or your neighbor. That's why it's so important to listen to an expert, get some professional advice about what plan is right for you and what is really, do you qualify for Medicaid? Should I have 24-hour home care? Which, all those things are so important. So instead of asking your neighbor, who may not be an expert, ask an expert.
So one of the things, you seem to have a good depth of experience around Medicaid, but there's MLTCs and there's what's called scoring. How does that all work, and what should people be aware of?
Oh, the infamous tasking tool. So MLTCs are managed long-term care companies. There's several of them out there. And when you're approved for Medicaid, they come out to do an evaluation. And there's a tasking tool that they score. That scoring is how they come up with the number of hours that you'll get approved for care in your home.
And people, if they're not aware, could get caught getting less hours than they felt like they needed to, wanted to, or were told they should be able to get.
Right. So sometimes I'll hear people say, well, my mother has Alzheimer's and therefore she should have 24-hour care. But Medicaid doesn't pay for supervision either. There's a program out there that's for a different that's for a different time. But initially they pay for assistance with activities of daily living, like bathing, dressing, grooming, locomotion. They just don't pay for somebody to sit next to you in case your family member might fall if they get up, in case they're going to wander. They don't pay for services like that.
So, Denise, how do people get a hold of you?
No. So I work at Lean On We, and my email address is Denise Kuhbier at Lean On We, and that's long. So I'll just tell you the phone number is 844-532-6669, and I'm extension 706.
Say that again, please.
Yep, it's 844-532-6669, and I'm extension 706. But if you don't remember that, Lean On We, and we like to say that everyone needs someone to lean on.
Well, that's true. And I know that one of your themes, as is mine, is educating people. So what are some of at least another area or two of educating people that you feel they're unaware and you feel is consistently a part of what you educate people on?
I guess it's a few of the things that we talked about. It's like what type of care you should get, whether you're safely living at home, whether you should apply for Medicaid, whether you should go to an assisted living, the services that assisted living provides, what they do and they don't provide. Like you may think that if you go to assisted living, you're not going to fall, but yet you don't have one-on-one services in assisted living. So it's just doing reality checks for family members as they make important decisions. And I'm happy to help if somebody has questions. You're welcome to call me and ask me some questions that may help you to make a better decision for your family member.
So 35 years of experience. I would have never guessed.
Yep, it's a long time.
Right. Starting in Westchester and moving your way and sticking around and being of great value to the community. Not just from the Alzheimer's Association, but educating people. And, I feel like education is really what everyone has to sort of look towards. And it's also about advocating, right? So people who have family members or even themselves, the adults, want to take care of their own situation until they can't. So do you see that? Do you see adults trying to sort of handle most of their needs themselves without involving their adult children?
Absolutely. They don't want their kids involved. Sometimes they'll tell me, don't worry, I'll take care of it. But that's not always the case. And when I speak to the children, they want to be involved. The parents will say, my daughter's too busy. And then I'll get on the phone with the daughter and they'll say, no, I'm not too busy. My mother doesn't want me participating. So I do see that the kids want to be involved and they want to help and they want their parents to be safe so they could put their head on the pillow at night and go to bed and know that everything's okay.
A tough conversation for both. And, you're not playing therapist, but you're certainly trying to work through those family dynamics for the best interest of whoever it is that your client is at the time.
That is true. I like to talk to the children, and then I'll get on the phone separately with the parents and really talk to them about their needs. And sometimes if they don't want the services, I'm going to let them know it's about making their children be able to be at peace when they're in their own house. So sometimes they agree to services just because they want their kids to be at peace.
So, one last suggestion to people listening on the air in terms of if they're dealing with themselves or a loved one who is looking for guidance in trying to make decisions.
Yeah, if you're looking for guidance, I would say to gather all the information before you make any abrupt decisions, and really check with the professionals and the experts out there. Ask around. Don't just make a decision based on one person's advice.
Well, that's great. So, again, your name and phone number.
Yep. So I'm Denise Kuhbier, and the phone number is 844-532-6669, extension 706. I'm with Lean On We, and just to put it out there, Lean On We covers the entire tri-state area.
And I am Mark Brownstein with Emerald Medicare, 845-358-1220, all things Medicare. I have been educating at the Greenberg Library and many other locations in Westchester. I hope someday to be able to help you or your loved one, as does Denise. I thank you for your time, and I will see you next month. Be well, be safe. Thank you all.
Thank you, everybody.